Last week, Unity Point Health lifted its pandemic mask requirement for patients, making them optional at all of its hospitals in the state. Our Griffin Wright joins us from Unity Point Health this morning in Des Moines. Griffin, we're curious to know what other restrictions that Unity Point is easing up on.
Well, Jody, so while nobody really wants to end up in the hospital, if that does happen, having a loved one come and visit you can make a huge difference. And that's one of the things that is also easing. It's their visitor policy. So on top of masks being optional for most patients here at Unity Point Health, sick patients can now have up to 2 visitors come visit them. So Unity Point decided to ease their mask requirements and the visitor policy due to the COVID cases dropping continuously over the past few weeks. They decided this based off the total number of cases being per 100,000 people, which has been at the moderate level for the past few weeks. When that reaches low transmission, which is 10 or fewer cases per 100,000 people, then even more restrictions will change. But let's take a look at where things stand right now. So now patients can have 2 visitors at a time, and if it's for maternity services, they can have those 2 visitors on top of a birthing coach or doula. All guests need to be free of any signs of illness, and also exceptions can be made on a case-by-case basis by the nursing unit leadership for things like end-of-life care and extenuating circumstances. Unity Point says that safety is the #1 priority, so while cases seem to be lower, things could change in the future.
We don't want to be going back and forth because that causes confusion, even though we know that we're basing our strategies on the science and the transmission that's out there. People want to see that consistency, and we also want to provide that consistency. So that's why we waited a little while to ensure that we're at a moderate level. Now, hopefully the summer months, people are outside. We won't see this increase. It remains to be seen what will happen in the fall.
So if you are feeling sick, it's really, really important that you make sure that you're wearing a mask still when you are visiting the hospital. Basically, if you're coughing or if you have any of those symptoms, whether it's COVID, the flu, or just the common cold, you still need to be wearing your mask. Now, also healthcare workers are going to have to wear their mask. That's going to stay the same. Hopefully we can move towards kind of that low transmission level so we can get back to kind of that pre-pandemic normal that we've all been waiting to get to.
Yeah, there is light at the end of the tunnel. Thanks so much, Griffin.